on stress related disorders. Okay, initially actually the first session was supposed to be taken by Dr. Ashish sir, but sir is stuck with some other program event, so he'll be coming later, he'll be joining later, and he'll be taking the other part, right? So I'll be dealing with the concept of stress and its management through yoga, right? Since I am my expertise in Ayush is yoga and naturopathy, so I'll be dealing with the management through yoga, right? So how many of you are aware regarding what is stress, types of stress and stages of stress? Are you aware of this? You must be, right? So what is stress? How do you define stress? How do you define stress? Tell. How do you define stress? You're in third prof, right? So you must have come across stressful situations, right? Examination stress is one such stress, right? So what is stress? A stimuli, right? A response, right? Okay. So let's see. So my part was to deal this thing. Okay, philosophy of yoga, yogic diet and stress, and IAYT, that is the integrated approach of yoga therapy for stress and meditation, and as well as research papers I couldn't actually complete. Like in between I have quoted, so I'll be telling those findings of the research papers, right, and the conclusions. So this was my part, right. So dealing with what exactly is stress. Stress, it has its own theories, there are many concepts of stress. So stress as a stimuli, right. According to this concept, stress is a stimulus which causes physical and mental changes in an individual, and everybody has a fixed capacity of a threshold of bearing the stress, right. So everyone has a fixed capacity to withstand the stimulus, and once it has exceeded, then a person is said to be stressed, right. So there is something called eustress and de-stress. You are aware of these terms? You are aware of these terms? Eustress, de-stress? No? Okay, fine. Okay. And the other concept of stress is stress as a response. That is the fight or flight response. You have heard of this response, right? So that is nothing but stress as a response. So according to Hans Selye, who is a Hungarian Canadian endocrinologist, okay, who is also said to be the founder of the stress theory, right? So he and Levy, they have defined stress as a non-specific, conventional and phylogenetic based response, and the primary function of which is to prepare for a defense reaction, which would help in a protective and an adaptive, which will help in the protective and adaptive function, right. And the other concept of stress is stress as a perceived threat. So this is the recent concept according to Lazarus, which was, during this concept was during the year 1970s, right. And he says that stress occurs when there is a demand of an individual, right, and it depends on the perceived stress. That's what we call it as a perceived stress, right. According to him, stress is neither a stimulus nor a response, but when an individual perceives and evaluates a stimulation as threat, then that person is said to be is in a stressful situation, right. These are some of the concepts of stress, and this is the stress response or the fight or flight response. So I think everyone knows, fight or flight response, right. So these are the what do you call the fight or flight response. What it does to the body is it converts the glycogen to glucose, and it increases the blood pressure, the respiratory rate increases, and there is the decreased in digestion and even decreased in temperature, right. So these are all some of the symptoms of the stress response. So stress, in other words, according to WHO, it can be defined as a state of worry or mental tension caused by a difficult or a threatening situation. So it is a natural human response that prompts us to address challenges and threats in our daily lives, and everyone experiences stress in one or the other way, and however how we respond to stress is the difference, right? So types of stress, they are broadly classified as eustress and distress, and based on duration also it's classified as acute and chronic stress. So eustress is a minimum amount of stress in life, like examples of having a baby, getting married, any sort of such milestones which happen. So that is the minimum amount of stress wherein you can be active in your daily life. So that is the minimum amount of stress, eustress. And distress is stress in life such as experiencing divorce. These are certain examples: injury, punishment, negative feelings. So all the negative connotations, they give rise to distress. And acute stress is the the acute response to stress is the acute stress, that is the fight or flight response, and the body prepares to defend itself, and it usually takes around 90 minutes for your metabolism to return back to the normal. And this continuous stress, it can land us into the chronic stress, and like for example is all the day-to-day activities. And I think most of us right now, we are into such an era where we have multitasking. We have to do multitasking, right? So sometimes if we are not able to manage these stressors, multiple stressors, so we may land into chronic stress. And if this is not controlled, or if this is not taken care of, then we may land into certain physical ailments. So these are the three basic stress responses. What we usually do, either we tolerate the enemy, or we fight back, or we take a flight. So these are the stages according to Hans Selye. He defined stress as the body's non-specific response to any demand, either it be a pleasant or an unpleasant demand. He hypothesized into these three components like alarm stage, resistance stage, and exhaustion stage. Alarm stage is the body's immediate fight or flight response, where all the hormones they get released, and all the physiological functions like heart rate, blood pressure, and respiration, they usually increase. And resistance stage is the stage where the body adapts to this kind of stressor and it begins to resist it. So the duration of this phase, it again depends on the body's energy to cope up, and also the intensity of the stressor. And the last stage is the exhaustion stage, wherein the stress continues and the body's adaptive energy is depleted, and due to which there is a wear and tear. And at this stage, because of this prolonged stress, it can be fatal, and it can lead to other diseases, like example is like digestive disorders, withdrawal symptoms, headaches, tension, insomnia, loss of temper. All these can lead into the physical ailments. So this is the physiology of stress. I think it is not required. I think you have already you know what is the physiology of stress, right? So stress reaction, what happens because of the stressor? These heart rate, breath rate, sugar levels, blood pressure, they all increase. Now this is the flight or fight response via the SAM pathway, that is the sympathomedullary pathway, which is the short term response, or the long term response is the HPA system. So this again is the acute stress response, and if this is not taken care of, then it can land into the autonomic dysfunction and cardiovascular risks. This is the pathophysiology of the chronic stress. So you can see if there is a chronic stress, it can hamper or it can trigger the HPA axis, because of which it can also lead to the sympathetic SNS, sympathetic nervous system activation, which can lead to the insulin resistance system activation. Co-features, you can see that there would be insulin resistance, there would be glucose intolerance, dyslipidemia, visceral adiposity, hypertension, which can also lead into the adverse cardiovascular responses, and which can end up into the cardiovascular diseases and related disorders. This is the pathological sequel of the chronic stress. The causes of stress can be internal, and it can be many. It can be internal, it can be genetic factors, it can be inability to adapt to the stressor, inadequate relaxation response, or response activity variations, or any autonomic dysregulation. Age can be one of the causative factor. Personality, it can also be one of the causes of the stress. Now, the stressors, what are stressors? And stressors can be again divided into external stressors, internal stressors. External stressors are the physical environment, social interaction, or any major life events. They can be the external stressors. Internal stressors, they can be your inner conflict of mind, pressure, peer pressure, example, frustration. All these can be your internal stressors. So, these are certain signs of stress, that is lack of enthusiasm, anger, nightmares, confusion. These are some of the signs of stress. And symptoms, it can be physical symptoms and mental symptoms. Physical symptoms, like these are all the physical symptoms, like headaches, insomnia, aches and pain, digestive changes, breathlessness, palpitations, etc. These are all the physical symptoms which we usually see in a stressed individual. And these are the mental symptoms, like lack of concentration, confusion, disorientation, panic attacks, and difficulty in making decisions. These are all the mental symptoms. Now, this is the ICD-11 International Classification of Diseases. These are the disorders related to stress and trauma. So, post-traumatic stress disorder and CPTSD, that is complex post-traumatic stress disorder, and PGD, that is the prolonged grief disorder, adjustment disorder, and other specified or unspecified disorder which are specifically associated with stress. And acute stress reaction, these are the major areas which come under the disorders which are related to stress and trauma. Stress induced health problems. So, as we all know, if it is not tackled on the right time, so it can land up into these health issues like hypertension, diabetes, heart diseases, backache, insomnia, depression, irritable bowel syndrome, psoriasis. So, these all are usually certain stress induced health problems. These are the general measures, that is the stress reduction measures, like creative imagery, thought stopping. There are certain grounding techniques or self-management techniques, group or social support, meditation, biofeedback, and self-hypnosis, time management. These are all certain strategies which are usually used in stress coping techniques, as a stress coping techniques. Now, coming to the part, my part, that is what is yoga and what is the concept of disease and concept of stress according to yoga. So, yoga is an ancient Indian system of medicine. It is most popular among Shat Darshanas. Shat Darshanas are the 6 Indian philosophies, among which one is yoga. And yoga is both the goal as well as it is the means to achieve a state of perfect harmony of body and mind. And yoga offers as a philosophy, and apart from that, it also preaches the methods to practice it. And it is an art of living, a systematic process to reach the state of the ultimate goal or aim of yoga is liberation, which is also called as moksha or samadhi, that is endowed with perfect silence, knowledge, power and bliss. So, therefore, yoga is a way of life. It is basically a way of life or a lifestyle. Now, evolution of yoga, it is dated back to more than 2000 years back. So, as you can see, during the Vedic period, yoga, it has been quoted in Rig Veda. That is the most oldest form of Veda, Rig Veda. Also, it is quoted in Atharva Veda, right? And that is almost dated back beyond 2000 BC. And it is also been mentioned in Upanishads, especially Mahabharata and Bhagavad Gita. These are all certain pre-classical period texts. So, wherein yoga is being mentioned in these traditional texts. And Patanjali, he is usually called as the founder of yoga, because he is one of the sage who has compiled the entire knowledge of yoga. So, founder or the father of yoga is called as sage Patanjali. and Hatha Yoga Pradipika. So these are all certain texts wherein you can see there is a mention regarding yoga, how yoga can be utilized, right? And Swami Vivekananda and others, they have actually conceptualized, and they have actually revealed the concept of yoga to the modern world, or they have popularized yoga, rather, in other terms. So popular definitions of yoga, what actually yoga is, definition of yoga, yoga chitta vritti nirodha, that is, yoga is the mastery over modifications of mind. So this reference is given in Patanjali Yoga Sutras, and there are many definitions which are whose references are here in Bhagavad Gita, in Yoga Vashishta. There are many definitions, and all these definitions are said to be right, and these are the popular definitions. Yoga is equanimity of the mind, and yoga is a subtle technique to calm down the mind. It is yoga is excellence in action, and it is the one which severes the, that is, it severes in the sense it divides the connection between connection with the sorrow. And yoga is the destroyer of the sufferings for the one who observes moderation in eating, sleeping, recreation and work. So these are certain popular definitions of yoga according to the traditional yogic texts. Yoga, as we all know, so as I have said, it is a way of life that places great importance on a proper and a healthy lifestyle, whose main components are achar, that is healthy physical activity and exercises, vichar, that is right thoughts and right attitude towards life, which is very vital for well-being, ahar, that is healthy nourishing diet with adequate intake of fresh water and a balanced meal, that is sattvic diet, okay, which is freshly prepared and which is freshly prepared and freshly served with love and affection. So even the mental attitude while preparing food is also very important. Vihar, that is proper recreational activities to relax the body and mind, which are very essential for a good health. And Vyavahar is a very healthy interpersonal relationships, which is essential for a good social health. So these are all main components of yoga: achar, vichar, ahar, vihar and vyavahar. These are streams of yoga. So these are need not go much into detail. I'll just tell Raja Yoga. It is a path of meditation, and Ashtanga Yoga is nothing but it comes under nothing but Raja Yoga. I think Ashtanga Yoga, you have heard of Ashtanga Yoga, 8 limbs of yoga, which was given by sage Patanjali, which are yama, niyama, which are social etiquettes, asana, pranayama, which focuses on the physical health, and pratyahara dharana, which focuses on your mental health, right? And dhyana and samadhi focuses on your spiritual health. So these are all 8 Ashtanga Yoga. Ashta means 8, right? 8 limbs or 8 components of yoga, right? So Bhakti Yoga, these are many streams, or we can say schools of yoga: Raja Yoga, Bhakti Yoga, Jnana Yoga, Karma Yoga, Hatha Yoga and Tantra Yoga. So these are all many ways and ultimate goal or ultimate aim of practicing these different ways of yoga. So the ultimate aim would be the liberation or moksha, that is breaking the barrier of cycle of birth, rebirth. So an overview of the 8 limbs of yoga, that is according to sage Patanjali, yama and niyama, these are the social etiquettes. So yama has 5 ethical perspectives. So these are satya, ahimsa, brahmacharya, asteya and aparigraha. That is, these are certain individual observances which control our instincts, right? So satya is being truthful to oneself and to others, right? Ahimsa is practicing non-violence. Brahmacharya is being celibate, right? And asteya is non-stealing of not only objects but also ideas of others, right? And aparigraha, that is non-hoarding, right? These are all certain social etiquettes which one is supposed to follow. Niyama are 5 individual observances, that is shaucha, santosha, tapas, swadhyaya, ishvara pranidhana. Shaucha is cleanliness of both body and mind. Santosha is satisfaction with whatever you have in life, being content. Tapas is austerity or perseverance, that is perseverance, that is being humble. Whatever you achieve in your life, you are humble, so that is being austere, or that is being tapasvi. And swadhyaya is self introspection. Okay, at the end of the day, you are always supposed to have swadhyaya or self introspection. And Ishvara Pranidhana is surrender to the higher, almighty or consciousness. So these are all certain 5 niyamas which promote the higher order, or these are basically which promote your social health, right? So these are social and spiritual behaviors, yama and niyama. And coming to the asana component, Stiram Sukham Asanam, that is bending or doing advanced series is not just called asana or yoga. It is asana is just one component of yoga, and you should the posture should always be steady and pleasant. Stiram Sukham Asanam. So achieving stillness of the body is nothing but asana. And pranayama is in the state of being in asana or posture, breaking the movement of, that is rhythmic breathing exercises, whatever we call, is nothing but the pranayama, or regulating the breath is nothing but pranayama. Now this achieves possible rate of breathing and fluctuations in breath. So pratyahara is turning the consciousness to inwardly, and dharana is again developing an ability to focus the mind. Dhyana is expansion of the consciousness, and yes, samadhi is the dissolution, or it is nothing but having the deeper insight into one's own nature is nothing but the samadhi concept. So these are all basically the Ashtanga yoga, or the 8 limbs of yoga. So this is concept of health according to yoga. So according to yoga, there are these are pancha koshas, that is 5 sheets, right? So our body is basically composed of these 5 sheets, or 5 ethereal sheets, what we call Annamaya kosha is the physical body, okay, musculoskeletal system. Pranamaya is your prana, the vital capacity, vital force, and Manomaya is the mental sheath, right? And Vijnanamaya is your intellectual sheath, and the last is the Anandamaya sheath, that is the state of bliss. So these all sheaths should always be in a balanced state, so then only one is said to be in a healthy condition. And integrated approach of yoga therapy, so in whatever yoga therapy whenever we give, we have to always keep in mind of this integrated approach, that is Annamaya kosha, the physical sheath, Pranamaya, sheath of prana, Manomaya, that is Annamaya kosha, physical sheath, usually all your asanas come under this, and Pranamaya kosha, the pranayama component, Manomaya, the pranayama as well as the meditation component, Vijnanamaya is the pratyahara component, and Anandamaya kosha is, it's a combination of all these. So if all these are in a state of healthy, then one can attain the state of bliss. Right? Imparting therapy in yoga is based on this categorization of the human body. So this is basically a holistic approach of yoga. So this is the concept of disease. I'll not go into the detail of it. So just if there is any haphazard flow of this prana, the vital force in the body, or instability of nadi. Nadis are nothing but channels wherein the prana or the vital force flows, right? So if there is any haphazard flow of this prana or instability in nadis, so that can lead to underdigestion, overdigestion or wrong digestion, which can lead into the physical ailments. And this can be usually the psychosomatic, almost all the psychosomatic ailments, we usually say that it is because of the Manomaya kosha imbalance. In this kosha, the psychosomatic ailments are said to arise. So concept of stress, so I'll not just skip this concept of stress in yoga. So what happens is thinking of objects. So according to Gita, thinking of objects which are real or imaginary. So if you constantly brood over things which are real or imaginary, you can end up in desire towards it, infatuation, anger, disturbed awareness, which can lead to loss of memory, mental illness and destruction. So these so being attached to any materialistic things, so that can lead to the stressful situation. So that can lead, that is the concept of stress in yoga, that is adija vyadi. That is any mental modifications, mental conflicts running in your mind that can land up in your physical ailments. So that is the signs of disease, right? Signs of disease, right? Or the concept of stress in yoga. Now, origin of stress, as I said, the same thing. It is because of the kleshas. If you are ignorant, if you have egoism, if you are attached to any imaginary or real object, or any repulsion and aversion to either a being or an object, and any fear of death, and the will to live. So that can, these all kleshas can lead to stressful situation. So this attachment can lead to desire. This can lead into strong likes and dislikes, which can end up in anger. Anger can end up in greed, lust, fear, possessiveness, etc., which can lead into infatuation, lack of awareness, and discriminative power. So this all can lead into the ego, that is attachment, and this can land up in the stressful situation. So integrated approach of yoga, this would be the last. So this is there are 4 stages, that is the psychic, psychosomatic and somatic and organic, right. So in this we can, in the psychic phase, we can give relaxation and meditation techniques which can help in complete recovery of the patient, and apart from that, psychosomatic, in this we can give pranayama, asanas and deep relaxation technique, wherein we can control the person's stress. And when it comes to somatic, we can give as an adjuvant to the conventional management. So we can add deep relaxation technique, asanas along with the conventional management. And this can also help gradually, once it is tackled, once the person is able to manage stress, so they can gradually we can taper the drugs. And in organic phase, we can also give them yoga, kriyas. Kriyas are shat kriyas or the cleansing techniques, and also the relaxation techniques. So these can basically, they can gradually reduce or slow down the rate of progression of the disease. So these are certain asanas which I have just jotted down, certain asanas which we can give, that is which we can administer, we can advise. So that is standing asanas and sitting asanas like Tadasan, Ardha Kati Chakrasan, Padhastasan, and these are certain standing postures. The other sitting postures are Vajrasan, Shashankasan, Ushtrasan. These are certain sitting postures. Pranayama, Nadi Shodhan, that is the alternate nostril breathing, Sheetli, the cooling pranayama, and the humming bee breath, if you have heard of it, that is Brahmari pranayama. And the last would be the relaxation techniques. They are certain relaxation techniques which can help in this stress related disorders, like instant relaxation technique, quick relaxation technique, and certain technique like SMET, that is self management of excessive tension. So these are certain relaxation technique which can actually eliminate the imbalance in your Manomaya Kosha, or the third sheath, the mind sheath. And the last part is the meditation, Om chanting. So this acts on the limbic system. It helps in deactivation, or it helps in regulating the disbalance happening at the limbic system. And these are certain which I have just jotted down: Trataka, Yoga Nidra. These are all certain MSRT, mind sound resonance techniques, pranic energizing technique. These are certain techniques which can help and which are very effective in effective yogic interventions which can be practiced in a stress related disorder. Conclusion: yoga has an important role for lifestyle modification. It gives a holistic approach. So usually we give an integrated approach towards yoga therapy, and it is also used in as a preventive medicine, and it can be incorporated in treating other conditions as well. And yoga practice is the best way to manage stress, and also research has proven that it is one of the best way to de-stress oneself. Thank you. हाँ मैंने अपलोड कर दिया सब. इन्होंने क्या कर दिया, एक सेकंड. सर आपका वो नाम क्या था? दे तो दिया है सर, मैंने डाउनलोड भी कर लिया था. हाँ सर.
ठीक है. Okay, so I think those who are sleeping can be made awake. You guys had breakfast? Not, I guess. Yes or no? Okay, that is why. So it is beyond our control. I wonder why you are sitting at the back side, those backbenchers. Okay, so I think I am audible. Okay, if you are not coming forward, I will come backward. This is how it will go. Okay. Okay, so stress. The topic is stress, or Madam has already discussed about briefly about all these things. I want to ask what you think what you think like effect of stress. Whether, let's suppose, first you tell me what you think that which is the most severe stress according to you, and which is the most light stress which you can experience. Yes, team A and team B. I'll do always like this. Team A will tell me most light stress which you think can be now for a medical student or in general any population. Yes, quickly, because we are running short of time. It's not exam, you can answer anything. Yes, someone said something. Yes, yes, you can say. Yes, answering in class. Okay, so someone mentioned answering in class is a stress. Okay, light category. Okay, we move on to team B, highest category, which is most severe, giving physiology viva or final exam. Is it, or something more? Anatomy, someone said. Okay, no faculty is from anatomy is here, so don't worry. Okay, anything else? This is related to medical, but in general for normal people, what do you think? They will not give answer in exams, they will not appear in anatomy practicals or theory. So for general public, what can be the lighter stress and maximum? Quickly. This is not some super rocket science sort of. Yes, you can't think of anything. Shravani. Yes, losing someone close to you. Yes, it's a severe stress. Lighter? Anyone? Okay, missing exam, something like that. Okay, you are not able to answer. Yes, try to understand there are categories or degrees of stress in life, any individuals, and why knowing that is important, because the degree of stress will also impact in a way which will be different. Lighter stress will affect you differently, severe stress will have a different set of symptoms, and that is why you need to know. So lighter stress can give you, for example, someone said giving answer in class or something, you feel anxiety, you feel palpitations, you think maybe my answer is wrong, what my classmates will think, whether I look like fool or something like that. Coming to, according to you, severe stress giving anatomy exams, you think okay, marks related, informing parents of poor marks, something like, yes, it's important. You understand that you feel the different kind of emotion in both the settings, right? If you are appearing for interview or giving practical examinations versus you are talking to your friend or maybe something else, different emotional experience you have, and this is where the things start, and this is where you need to understand that severe degree of stress, there are higher categories. Can someone try to think, and you read newspapers, print media, what is happening in nowadays? What kind of stress? Earthquake, bombing, deaths, all those wars, whether it's a stress. You watch movies, you see movies on wars, world wars and all those kind of things. So those are severe categories of stress. And when we'll come to, I think it's not moving. Okay, so what has been noticed that degree of stress will have a different set of impact on individual's life, and this is where the things started, that lighter stress will affect in a different way and severe stress, and the impact will be more duration wise as well as severity. So it started with, like I mentioned, if you are able to notice, acute responses reported by soldiers who fought in the First and Second World Wars included re-experiencing symptoms, dissociative responses such as numbing, amnesia and depersonalizations. Now this is where I want you to focus, that try to see, you will not experience these kind of symptoms when you have a lighter stress. So you need to understand, in our human existence in society or in the world, there are certain situations, circumstances which human beings are not capable of handling, and those impact very deeply psychologically, and the symptoms, for example, re-experiencing those symptoms, you see in sometime in movies, the actor or actress sometimes seeing someone who is assaulting them, they see those images that someone is coming to harm them, you see sometimes. So this is the kind of symptomatology which you probably see in severe stressful situations, and those stressful situations are also crucial and different, those are not the simpler one. So traumatic events can lead to severe psychological disturbances, that is very clear, we all understand. It is important to understand because stress does affect, and how, in what ways. How it all started in 19th centuries, scientists started noticing that railway disasters, world war, holocaust, these, when these were reported, people started reporting various symptomatology, the kind of feelings or emotions they had in their mind, or they, so people started labeling, for example, fright neurosis, shell shock, survivor syndrome, combat war, those soldiers who went to war and their friends and colleagues died and they were left, this is where the survivor syndrome came. Can someone tell me what is that survivor syndrome? People started thinking why they are alive, their colleagues, friends died, they should have also, so they had guilt, they had negative emotions, so something like that. So you see, this is what the severe stressful situations can lead to. So traumatic stress, whether it can lead to any psychological disturbances, it became a debatable, whether people started thinking that we all, everyone is exposed to stress. For example, this entire batch has to appear in exam, right? But some will have anxiety, some will have palpitations, like this gentleman said, like giving answer in the exams or like giving answer in class. Some will not be able to experience those kind, or even if someone performs badly, they will be able to like go ahead without having any those kind of symptoms. So why this variation is occurring, you tell me. You are in now I think third year. Okay, so you must have experience in first semester or maybe second. You tell me, in this entire batch maybe 120, right? Okay, so someone would have experienced during your final first year physiology, anatomy or biochemistry final exams, maybe by external would have come, you were appearing, you were noticing heartbeat is very pounding, what will happen, what questions will come, whether I'll pass, fail, something like that. There will be some people who must be chilling out, right, in one corner, whether they studied or not. Someone who studied definitely would be hiding. But why this difference is there, tell me. Yes, team A. Perception of the situations. Also backbenchers, the intelligence ones always sit at the back, so they can engage in mobile and other things. Yes, anything. Yes, please, quickly, we are running short of time. Anyone this side? Either you are shying or either you do not know. Okay, so try to think likewise. If it's not just about the stress, it's about the individuals also. We all, any individuals have their own understanding, coping, strength as well as vulnerability, so that also matters. So it is not necessarily that for example, you would have seen that experiment, you stretch a elastic, you continue to stretch, it will go, but at a certain point it will break. Now there are two things, one is the elastic, the capacity, the elasticity of that rubber band, which is, for example, if it is durable or if it is thin, thick, as long as the capability will be it is. Second is the force we are applying. So two things are working, one is the capability, second is the force. So similarly here the individuals, you or any individuals, their own understanding, capabilities, strength, personality, support system, those, as well as the external factor which is the stress. So similarly that you need to understand that the outcome will depend upon the interaction of these two. Those who are capable, those who have support system, those who have resilience, they are psychological. For example, someone can study very well, someone can remember, some may not. So there are variations. So things like that. So something like that it goes. So this is where the dominant view was that traumatic event itself was not sufficient, and this is where the scientific progress started happening, that we need to have other part. So this is where that individual vulnerability as well as the impact of stressors which came, and this is where the outcome started happening. So we'll straight away go to the most important disorder, which is post traumatic stress disorder, which you very uncommonly see and you need to know. Probably you would have seen in some movies which I mentioned, that these kind of symptomatology. Let's see what it is. So main symptoms, if you see the re-experiencing symptoms, the individual who has PTSD, whatever, for example, someone witnessed that their closed one, someone mentioned that closed one died, someone has been killed, and they witnessed that some railway accident, some road traffic accident, a lot of bloodshed, and someone died in front of them. We very uncommonly see, and the impact, the visual impact as well as emotional impact of that accident can be very horrible. So those kind of images, experiencing that some truck came, someone hit, my uncle died, I was there, there was blood, nobody came, and those kind of emotions. So those images and experience, this is classically seen in PTSD. So it's not just about the accident, anything, sexual assault, railway accident, wars, anything, even either they experience on themselves as well as they witness it is happening to someone close to them, something like that. So flashback also, in which the person acts or feel as if the event is still happening, although event is over, but it is still happening. For example, a woman who was assaulted kept seeing the eyes of the perpetrator looking through the letterbox before he broke into her house, and a man involved in a severe car crash at night kept hearing the sound of the impact. You see, so this is what classically you see in PTSD. And despite the vivid memory fragments, intentional recall is often disorganized, and some patients have amnesia for the part of the event. What happens? Those things which are very traumatic, the experience is very difficult, it's very painful. Even if you experience some painful, let's suppose if you have some emotional pain, for example, pet related, something, you fell ill, someone lost a close one, you felt something, emotional pain or psychological pain, you tend to think this pain should not come. So similarly the body and the psyche tends to overcome, either suppresses it. So what happens, sometimes people develop amnesia, they are not able to recall, and it leads to, the trauma leads to intense distress and physiological reactions and are consequently avoided. People will avoid talking about the conversations about those events, they will have freezing or numbness. Someone who would have experienced, they try to push memories of the event out of their mind. So this is classically seen in this. The emotional states will range from fear, anger, guilt, sadness, everything, feeling detached, hyperarousal, in physiology would have read, hypervigilance, startle response, irritability, difficulty concentration. So you see the type of stressor leading to the psychological impact and the symptoms in various degrees. Okay, like if you have, for example, pneumonia, you will have cough, you will have fever. In malaria, you have fever with chills, right? Sometimes step ladder, those different patterns. So similarly here the variation is like this. Now briefly we will touch upon the DSM-5. We need to understand like what exactly is the diagnostic criteria. So it says that exposure to actual or threatened death, serious injury, sexual violence in one or of the following ways. Either someone is directly experiencing the event, witnessing in person as it occurs to other, for example, learning that the traumatic event occurred to close family member or close friends in cases of actual death, but not in print medias and all. For example, if you watch on TV someone like war or something is happening, that will not classify as a stress, but it is actually happening. That has the different impact. Presence of these symptoms, for example, intrusive distressing memories, recurrent distressing dreams about the content of the event, dissociative reactions. Once you come to, I think you have started psychiatry posting? Yes, not yet. You will see dissociative disorders, what exactly happens. And it will lead to avoidance of that stimuli, avoidance of conversations, avoidance of those events, places, trying to push the memories, people, places, conversations. Probably you would have seen all these kind of events or situations in movies. So negative alteration in cognitions, we will not go in much detail about the, but you try to see apart from the emotions, you have some cognitive changes also, like you forget in the exam. This student said, you are giving answer, you got confused, even if you remember, you get fearful, like I do not know, I studied but I am anxious, and you tend to forget. Cognitive disturbances are happening, right? So likewise, all these kind of things, expression in positive emotions, anxiety, confusion, same, so everything these, so these are hypervigilance, these symptoms will not go. So let's come to what makes a stressor traumatic. In everyday language, many upsetting situations can be traumatic, which we discussed in the beginning. Loss of job, divorce, failing an examination for students. Now only 0.4% of the community sample develop PTSD. This is where people who are exposed to stress, like I mentioned earlier, will not have. Those who are vulnerable, those who have. So it appeared that for PTSD, the stressor has to be significantly traumatic. It's not like you failed in exam and you develop PTSD, that I will not give my exams, I am seeing the images, I am failing in the exam. That is, we will not see. It has to be extremely traumatic stressor. This is where the simple or the mild level of stress versus very severe traumatic stress comes into the picture. Okay. So few people will contest that horrific event, for example, sexual assault, bombings are traumatic. Yes, of course, extremely, and this is where things started working out and the diagnosis came into existence. So you need to understand, for PTSD, the stressor, the baseline, the event, triggering event has to be extremely traumatic. We'll avoid this thing. In contrast, these are things. Now let's go, this you understand the conceptual understanding. Now management part in psychiatry is also involves CBT. Now you would have seen like counseling or therapy sessions, it looks, can somebody tell me what is the difference? You see, you would have seen probably like counselors are there, they are sitting on this side of the table, they are asking to you whether you are feeling stress. What exactly it is? Is it normal conversation which happens between friends, or it is something different? Tell me quickly. In 1 minute, someone give me the response, because we have to finish in very quickly. Yes, team B, anyone wants to give the answer? Shravani again, I know. Yes. Hmm. Okay, up to your understanding, whatever response. Any other? Someone can think of therapists or psychologists who are sitting and assessing or giving therapy. Is it different from the normal conversation? Because it looks like two people are talking to each other, one is saying I have this problem and someone is responding, showing solution. Is it same to like you talk to your friends, or is it different? Yes, someone says no. Yes, tell me how it is different. Whatever.
Actually, that psychologist also sees the body language, also the behavior, how
Okay.
he is responding to the answer. Is he taking time or
Okay, you get up and give loud answers to everyone so that the sleeping souls will be awake backside. Yes.
so the psychologist also
Hmm.
sees the body language of the patient,
Hmm.
how he responds to the answer, how
Hmm.
much delay he takes to answer, or
Hmm.
what kind of answers he was expecting, but he answered in that.
Okay, partly he is right, but it goes much more than that. I wanted to emphasize and try to make you understand that it looks like a simple conversation, but it is not. Okay, it goes into lot more cognitions. For example, you see cricket players are playing, you see on TV, you watch, anyone watches, everyone fond of cricket, any other sports, Anyone quickly? Yes or no? You see cricket is a very common. You see players are playing like on TV, and you see they are hitting the ball, they are sometimes edge going. It looks very simple, but it is not. You also play cricket, you think is it same? It's not. There is a hell lot of difference. Similarly, the conversation is much more. They understand the cognitions. For example, I'll give you one this thing. Let's suppose there is a person and he has cognitive distortion. For example, that my friend did not wish me, so he is not my friend. He started thinking like that. He will not understand. Now what kind of thinking is that? Someone's birthday is there, but his friend did not wish me. What exactly is happening? He is thinking that he is not my friend because my close friend did not wish me. What is that? Can someone tell me where is the fault? Anyone? Okay, you do not know. It's called cognitive distortion of black and white thinking. Black and white thinking, either you see things in a very bright perspective or completely dark. You have a close friend, he did not wish you on your birthday, and you immediately label that he is not my friend because my close friend did not wish me, I am breaking up. But you did not see whether he may be having some issues, he may be ill, he may be preoccupied, he may be having exams, he may have forgotten. It's a minor thing, but you immediately put your relationship at risk. So something like that, you have the way you think and you tend to create situations or your behavior changes. So this is where faulty cognitions comes in, and this is where they identify, and lot of goes, for example, in traumas also. So trauma focused cognitive behavior therapy. So it looks like communications, like two friends are talking to each other, but it is much more scientific. So there are a lot of cognitive distortions and it goes. So trauma focused CBT is one important psychological uh, therapeutic interventions where people are exposed. It's a very interesting field, psychology. If you try to see the kind of experiments, like you would have seen Pavlov's experiments and those kinds. So similarly, they are exposed and they are trained. The psyche becomes very strong, and this is where. So eye movement desensitizations, present centered therapy. So these are the therapeutic interventions. Medications also, SSRIs do work on these, and combinations of these. So basically combinations of pharmacological as well as psychological interventions. Concept you need to understand what exactly. So fearful situations, once when they are systematically exposed, they tend to master over those emotions gradually, and this is where the principle of trauma focused CBT or cognitive behavior therapy comes. That's what I wanted to. So you understand at least conceptually. Idea is not to make you very monotonous slides like this is the criteria. You, if you understand the concept, you will go back to the books and read, and then you will be prepared for the exam. But you need to understand. So understand PTSD, it's not a small or minor state, it has to be, it has a different symptomatology and management. This, if you understand, it is sufficient. Now let's move on to lighter one, what is called adjustment disorder. So since we are running short of time, I'll quickly just say minor stress, for example, lighter, for example, someone mentioned failing in exams, something, for example, not able to appear for interview, missing some ranks or a smaller, those kind of, it also leads to some sort of psychological manifestations, because what you did not get, you will definitely have. So the stressors will have a mind. For example, someone developed some medical illness, bedridden, fractures, relationship problems, this also leads to some amount of psychological manifestations. Those are unwelcome, we do not want, but do happen. And this is where now one questions everyone experiencing. For example, if you do not get good grades, right, you want, somebody scored very poorly, you feel sad, right? Yes or no? Yes or no? Yes. Whether it's a disorder or not, you just tell me. I mentioned na, mild stress. For example, somebody, everyone would have fallen ill, everyone would have been in their lifetime, would have been admitted for pneumonia, maybe malaria, someone. It's a minor stress. Whether it will fall under the category of disorder if you feel stress. Yes or no? Or any answers? Quickly. Anyone? Team A. I think you are speechless. Okay, I'll give the answer. It is not actually. we also need to understand what is normal human responses and what exactly is a disorder. For example, headache for maybe 1 hour, we do not have any diagnosis, we do not diagnose fever, sometimes body weakness, feeling sad, because these are, we need to understand normal human emotions, reactions. Stress will always happen in the life, we will always experience some sort of negative emotions, but those are not diseases or disorder until some dysfunctions occur. For example, uh, we fail to take care of ourselves, we fail to take care of our responsibility. For example, someone who has some relationship problem, minor stress, but studies started declining, his self care started declining, person is not taking bath, person is not attending classes, grades are reducing, appetite is gone, this is where the problem comes. But for example, sadness is there, but the person is taking care of self, person is able to attend class. Similarly for medical illnesses, but someone is thinking I have pneumonia, I will not be able to do anything, bedridden completely although he is physically fit. So you see the response is undesirable. So this is where you see the dysfunction has cropped in, and this is where that when the dysfunction comes, then we will say it's a disorder. So it will also have a minor manifestation, sadness, anxiety, those kind of suicidal ideations also. Little specificity about the qualify these symptoms. For example, what would have been excessive, the symptoms must begin within 3 months of the stressor, that is also important. So stressor has happened recently, so symptoms occurrence, because it will take time and must resolve within 6 months of the removal. So if the symptoms complex, we will not go into that detail. Precipitating experience in the form of a stressful event or situations is an important part, characterized by development of emotional or behavioral symptoms in the context of identified psychosocial stressors, milder ones, okay, and symptoms vary widely in the form of severity, and the person may or may not be aware of the stressor. This is also important. Sometimes if you ask your friends or someone, they will say no, I do not have any stress. They fail to recognize at times. Some people will recognize, some may not recognize. So this is because of insight, that is important. So diagnosis and all we will not touch upon. We have discussed the conceptual understanding, but manifestation, low self-esteem, suicidal ideations, increase hypervigilance, impulsivity, substance use, people start taking excessive alcohol or tobacco at times to get rid of the stress, commonly we see in seminar and others. So all these kind of larger thinking. And coming to treatment, again psychological intervention, problem solving techniques, sometimes coping is poor, so we have to teach them or train them the right coping. For example, excessive tobacco or alcohol consumption is not right, so they have poor or maladaptive coping strategies also, so that also you need to identify. So it's not very simple, it looks conversation, but it is much more deeper and scientific. And definitely medications also, SSRIs, which you used for depression. And what commonly you answer, if you anyone ask you in OPD what you will give, you will say SSRI. Beyond that you do not know anything, right? You just read your pharmacology cat junk you read, I doubt. You read just three, you name 3-4 drugs, escitalopram, fluoxetine and sertraline. Beyond that you do not know. You guys need to start reading. So understand the difference between two disorder, yes or no? At least be louder, okay. So minimizing the stressor, teaching psychological skill, working with the meaning of the stressor, ongoing suicide risk, all these forms of, once you start your psychiatry posting you will get to know all these kind of things. Medication should be used, insomnia and anxiety and antidepressant for moderate to severe level. Basically we also have to teach them about the stressors, coping strategies. So all these are simple. So my idea was to make you understand in a cognitive way and a conceptual understanding, and diagnostic criteria and theoretical aspect you can read from the textbook. If you have any doubt you can always reach out to me and you can ask me also here anything. Okay, so before you go for breakfast give your attendance. Okay, Ritika, you take the attendance. Any doubt? Yes or no? I feel everyone understood. You will have exams. Okay, so we will give you stress, traumatic stress. We will ensure that you want less stress or more? At least you tell me now, otherwise definitely you will put less stress or severe. Huh? Okay, so we'll keep exam simples when you will have. Okay, have fun. Take the attendance. After 1 second, after the attendance, you have class again. Posting. So you will have some food and then go. Okay, right. Okay, madam. Hmm? Oh, shit. Thank you.